Good afternoon, everybody. Just give us a couple more minutes. I see our numbers still continuing to increase, and we'll get started here in a few. All right. Well, good afternoon, everybody. We still have folks joining, but we can go ahead and get started. Thank you all for joining us for kind of the culmination of this project and work group meetings and conversations we've all had pertaining to host home provider oversight. This has been kind of in the works over this past year, really having good conversation and gaining insight into how the department can make recommendations for improved oversight. As a reminder, the legislation passed required or asked the department to come up with recommendations on how to provide better oversight of our host home settings for on our developmental disabilities waiver. We have, over the course of the past several months, been engaging with you all to better understand what we can do as a department to make that oversight improved, whether that is something that we need funding for or regulation changes or changes to the oversight process in general. You all have helped provide some information to develop those that we are putting together. So the next steps of this process is we are taking these recommendations that we're going to share with you, fine tune them a little bit more, and then that is going to go into our legislative report that we are submitting to the legislature. In order to make sure that we hear all of you, we will be sending out or giving you a link to a survey so that we can make sure you can see in writing, these are what those recommendations are, and then provide that direct feedback on, yes, I like this, no, I don't like this, here's how it would be tweaked. So we will be giving you that link to the survey. That's kind of the end. By no means is this the end of ever doing anything pertaining to host home oversight again. But what this is the end of the collection of feedback, development of recommendations, and then submitting that report. So obviously we will continue to engage stakeholders throughout and on a regular basis, but engagement pertaining to this very particular project is coming to an end. I think those were kind of the opening remarks I wanted to make. There is not a link to the written report at this point. The report is not written and it will be submitted. I believe it's due to the legislature in January. So we have to vet that report, get everything finalized, and then it will be submitted to the I think it's either the SMART hearing or the JBC. It will go over to somebody in the legislature, and then it will be published and available for your review. The survey is just going to go over what those recommendations that we're talking about today, to make sure that we hear from everybody, since not everybody wants to speak up or chat their thoughts and feelings. This is just one kind of final way we are going to collect that info. So we had held a couple of different specific work groups to talk through what we really want to do in terms of making certain recommendations. So Jody Walters is one of those members from our work group who has graciously decided to report out that information and those recommendations to you all. So I will be handing it over to her in just a second. We will try and keep the survey open for a good portion of time to collect that information, Maureen, but we do want to make sure that we have time to take what feedback we're getting out of that survey, make any necessary changes, and then still submit. So before I hand it over to you, Jody, sorry, our mission obviously is improving healthcare equity, access, and outcomes to the people we serve, while saving Coloradans money on healthcare and driving values of care for care. Just a couple quick introductions. You've got me, Cassandra Keller. We have Victoria, Meg, and Grant from the department. We have our friends from Mission Analytics and Jody Walters from Imagine here today to talk to you. As I mentioned, this is kind of our last scheduled stakeholder meeting to discuss these report recommendations. We're going to have report out detailing info on the Complaints and Grievances Workgroup, database review, and talking about that standardized host home contract. All right, I think here's where I hand it over to you, Jody. Okay, great.
Yep. Good afternoon, everybody. Like Cassandra said, I'm Jody Walters with Imagine, and I get the privilege of going over the current process with you. So for everybody on the call, this is not going to include a lot of surprises, but again, it's just kind of painting part of the background as to why we are here. So when there's a complaint specific to a host home specifically, or something that has occurred within the host home, currently there's not one way across the state, one single entry point for that complaint to be filed. A lot of those complaints are filed with CDPHE, but that doesn't mean that HCPF is aware of what all of those complaints are. And if that complaint is picked up from CDPHE, often what CDPHE's, well, not often, entirely what CDPHE's lens currently is that they are looking at the provider agency, not down to the specific host home, which has led to a lot of ongoing concerns. Background checks are currently only required pre-employment and annually, as is the CAPS. That's not an issue for the CAPS because the CCU unit or the CAPS office flags those checks and can reach out to whoever has made those requests. But it is an issue with the background checks. Not only is there not necessarily a standardized type of what is an appropriate level of background checks, but federal background checks are not currently a requirement. And there is no current requirement for annual checks or ongoing checks. Provider agencies, as we well know, have the ability to cancel the contract with kind of quote unquote the bad apples of the host home provider world. But there's not currently a process that follows that provider and ensures that they're not able to then become a provider for another provider agency. And CMAs do investigations, but those are typically after a CIR has been, or they do monitoring, not investigations. I apologize, language is important, and they may do some increased monitoring after a CIR is submitted, but that is not necessarily all tied together either. Next slide would be great. So some of the recommendations, and I want to be clear, this is the only other slide I am presenting. And this is part of the picture. So, right, initially when I looked at this, I was like, well, that's all. But these really dovetail all together. So as you are hearing this, wait for more to come, because I think it's really important about how all of these different requirements or suggestions kind of fit together. So one of the suggestions that has been made is that there be a single entry point for all complaints as we move forward. Right now, you can, as I said earlier, you can make those on a couple of different state websites, to your case management agency, your provider agency. But that there is a single entry point for all, aka kind of that no wrong door philosophy. There is also a suggestion for increased monitoring by case management agencies. And then some increased resources for HCPF or CDPHE to conduct thorough investigations at the level of the host home provider in a timely manner. So that is my section. I think I pass it off to, not sure.
To me. Hello, everyone. My name is Meg Yanaba. I'm an HCBS benefits supervisor here at HCPF. And one of the other tasks that we were given during this bill is, how do you remove a non-compliant host home provider? So we, through several discussions and brainstorming on how this could happen, we've come up with two different options. The first option would be enrolling host home providers with a unique provider identifier. This would allow for this to be completed within the existing infrastructure and statutory authority that we already have here at the state. And with the host home provider being enrolled, that host home provider can be terminated if they are performing unsatisfactorily. What this allows for us to do on our end is, rather than discontinue payments or suspend payments for a provider agency, with this unique provider identifier, we would be able to suspend payments to a applicable host home provider, which would then potentially prevent them from going and jumping to another agency. I do want to be clear that the provider agencies with this approach would still be doing the billing, not the individual host home provider themselves. The billing line item would be just specifically identified to that member that is in that host home with that unique provider identifier. The second option that we've come up with is to create an internal process for placing host home providers on a prohibited provider list. This list does require some statutory authority to allow the department to create and maintain this list. It also would require a full-time employee to manage this list, and the development of due process for those placed on this list. The process for the due process would involve several layers of kind of rehabilitative work to make sure that the person, that if they were placed on a prohibited provider list, would be able to prove that they are meeting regulatory needs and their work performance is in fact heading towards more satisfactory in order to be able to come off that list. Go ahead, Cassie.
Yeah, thanks, Meg. I just wanted to provide a little more context and information about these two options. Certainly, we did not try and load this second option with a bunch of additional resource needs to try and sway a decision one way or the other. But with the, if host home providers do in fact kind of enroll with that unique identifier, that due process is already built in place. There's an appeal process providers would then be under contract, those host home providers would be under contract with the department in a way in which we could sever that relationship and prohibit them from coming back into the system and re-enrolling. If we were to create this, as Maureen put, a blacklist, what we are saying is these are providers in which there is a concern that there is significant concern with the quality of care that they're providing, and they would be put on this list. There's a lot of due process work that we would need to develop in order to make this happen. And so that's why there would need to be a lot more work to flesh this out, move this further. But if they were to enroll with HCPF, I'd like to think of it a little bit like if you're looking at a physician's office and then rendering physicians under there, you'd have that larger enrollment, which is the PASA, the provider agency, and then those kind of host home providers or those individual practitioners that would enroll with HCPF as well. You're kind of affiliated to that PASA. That's how those claims would go. So they would enroll with Medicaid, HCPF, they would not be with CDPHE. I think that question came in there. So hopefully that provides a little bit of context on kind of where we got with these two options. But really, we continue to come up against a wall of, can we really, as a department, prohibit someone from future employment by putting them on a naughty list? And so that's really where the struggle became. Is how do we get past that? And so these are the two options that we've been able to come up with.
All right. So one of the other things that we have discussed developing, and we've asked for Mission Analytics to assist us with, is the implementation or the creation of a database. The stakeholder recommendation was for a more effective and accessible database to track host home providers' experience and job performance concerns. As I said, this was developed by Mission Analytics to capture work history, service location, and reported issues pertaining to job performance, ethics, and the health and safety of members served. And I believe I am going to ask Peggy if she could share with us a little bit more about this database.
Thanks, Meg. Can you hear me?
Yes, we can.
Great. And I should say this database, many of the pieces are in place, but some of them loop back to some of the other issues that we've been talking about today. Just to give an overview, we are envisioning different views for PASAs and for host home providers. And also there would be access for CDPHE and HCPF to do reporting. And really one of the things that has been slowing down getting it fully developed is we're working on cleaning up a lot of the DOLA data. So we know that we have names in that are all different ways, things like that. So the idea is really, from a PASA perspective, to be able to see everybody who's being served in a home that you are contracted with. So you can observe through the database if there's too many members, for example, being contracted with, or if there's too many just for the size of the home. We are also, as we're describing, we can put in the database some of these markers in terms of, was there a complaint made to CDPHE that was about this home specifically? We can put markers for, was there a main allegation substantiated through a critical incident report, for example, and also be able to track whether there are the completed background checks and CAPS checks and things like that. We are anticipating that adults in host homes, adult residents other than the members in host homes will be asked to give identifying information such as a driver's license ID, so that we don't have people using different names, slightly different names in different contracts or different homes to try to get around some of the contracting issues. So I think that's a high level overview. When you complete the survey, if you are interested in helping to kick the tires, that would be great. I did see a question about the DOH database. I don't know if Meg, you or Cassie want to answer that. We are certainly aware of the issue of duplicating entry, and we are working currently from the DOH data.
Yes, I'll just piggyback on that. We are working collaboratively with DOH to transpose some of that information. And when concerns are brought up, we are in communication with them, as they also have ownership to the provider termination form, as well as other information, just in a more organized manner than we currently have. But we will be looking to transpose that information over to this new database. Peggy, was there anything else that you wanted to go over as far as the database, or am I okay to move on?
You're okay to move on. I'll just answer Julie's note that we do need to limit this to serious issues. I am aware of the issue of getting people to actually interact and enter the data. So that's one of the things that we need to be concerned about, and therefore, limit it to the things that might be such that it would be a warning to other provider or other PASAs, for example.
Thank you.
All right, good afternoon, everyone. Grant Reefer. I'm a HCPF benefits specialist here at the department, and I'm going to go through a few more of the recommendations here. There was some good conversation with groups around a prohibited criminal offenses list. Both the department and the work groups proposed that there be a prohibited criminal offense list within regulation, that if we find direct care workers or host home provider with convictions of those prohibited criminal offenses on their record, they would be unable to contract or be employed in HCBS services. Along with that, of course, we'd have to have an exception process. We would hear at the department an provider agency could ask for an exception to the rule. We would hear that and give our approval or denial for that. And some of these questions will be on your survey as well at the end, so you can have some input on those. Major criminal offenses, felony. We haven't finalized any list. We're just putting forth that recommendation. And one of the changes would be applicable to all HCBS staff, whether they're employed or contractors. So it should be a proposal for change as well. We've talked about background checks and the CAPS checks. Jody referred to that as right now we don't have a requirement for annual federal background checks. That will be in our recommendations, again, to catch some of those folks that may have had convictions in other states that now move to Colorado, and we don't have a way to screen them out. So it's going to increase our ability to prevent those folks from working in the field that may have had prior criminal convictions in other states. So next slide, please. And the standardized contract, we've talked a lot about the current process and how each provider agency is up to their own devices to create a contract to enter into with a host home provider, and that's really the only tool they have to enforce compliance with standards, regulations, responsibilities. So we talked about the idea of having a standardized contract, and during the discussion, it was brought up from several provider agencies that they had received a sample contract from Anchor, which is the American Network of Community Options and Resources, had shared a template contract with Alliance Colorado for sharing out with provider agencies, and a lot of agencies were customizing those contracts to kind of fit their agency-specific information. So the department took a look at the contract, and what we've done was we've added in regulatory standards for the appropriate sections of the contract that will hopefully increase accountability for the host home provider. It'll be very specific to these regulations apply in this area of your contract. You're responsible to uphold and provide those responsibilities in compliance with HCBS rules and regulations. And so we talked a little bit about possibly having a fillable form that would be located on the HCPF website that people could download and then customize to their agency with their agency specific policies, procedures. But the outline of the contract would have those regulatory standards in there and would still be customized to each agency. So currently the contract is being shared with the Attorney General's office, and we're waiting for feedback from them to see if it would be a feasible project or not. Anything to add, Meg, Cassie?
Nope, I think you covered that. Okay, and we can go to questions now. Let's see here. Will agencies be required to use the standardized contract? So as Grant mentioned, we have made recommendations to our legal department as to what type of information we would include in a standardized contract. They are currently meeting to go over a couple of different things the contract included. And so we should have some more information as far as their feedback and their response to that as things come down. But at this time, there is no requirement that a standardized contract is being used, as I said, at this time. Okay, and I see, Sarah, you have your hand raised.
Yes, I have a few questions. So I did watch all of the past recordings, and there was a few things that I wanted to mention to everyone today. Something that the state agencies and host home agencies need to take into account is that host home providers work 365 days a year, oftentimes without a break for years. It's not a 9-to-5 job, and it's not reasonable for PASAs that do not return calls, emails, or texts during the evenings and weekends to judge or shame host home providers for focusing on the care of the client and not always the documentation. It's unrealistic to think anyone can work 365 days a year, 10, 20, or 30 years and have flawless documentation. In 2020, my client went from a level 3 without notice from a level 4 without notice back down to a level 3 due to my agency and TRE not turning in the paperwork appropriately. I took my client to all of her doctor's appointments. I did everything that I could for her care. My documentation was in, and they failed to turn the paperwork in. It took me almost 2 years to get that corrected, and it was with begging and pleading to have a new SIS assessment. There aren't any grievance policies in place for a host home provider to report against an agency for their client or for themselves. The contract only states how to file a grievance against the host home provider. We don't even know if the agencies have had previous grievances filed against them. That process is extremely secretive, and I've filed with TRE before, and they sent me to CDLE, and there's nothing on CDLE website to file. I also wanted to bring up while I understand that some host home providers really struggle with completing their training, I've never heard, and maybe this is just from the Colorado Springs area, I've never heard of agencies not requiring training at all. While trainings may be completed late, I've never heard any host home provider say that they didn't have to complete any trainings. The two agencies that I've been with in the past 9 years, both use Relias, and my old agency, I should say, did not turn in my QMAP that I did. I did a recertification in 2022 that was never reported to the state. I also had insinuations that I didn't complete any training with them, which I provided my transcripts to my new agency just the other day. A public list on the agency website that lists all the trainings that are required by that agency will alleviate PASAs from misusing their power. And this leads to PASAs to requiring more, requiring more of one host home provider than another. Also, agencies control that training page, and they can complete they can make it to where you can't complete your trainings early if they restrict them. PASAs can make it harder for the host home provider, not allowing the host home provider to read at their own pace, only allowing the narrated version. This leads to wasting time. The amount of money that PASAs take from the daily rate is more substantial than a foreman on a job site. The average foreman makes 10 to 15% off of the work that they help complete, while PASAs take 30 to 50% of non-negotiable daily rate from host home providers. And the host home provider is the one that has all the risk. PASAs will state that new regulations, rule, law has come from the state. In reality, it's simply in discussion. This needs to stop. I'm sorry. The regulations, in simple terms that anyone, including the clients, can understand. Host home providers should be a part of the discussion. I am sorry. Allowing a host home provider to be the adult that they are and the ability to engage in workshops like this would take out a lot of the confusion. I was not aware of this meeting until I happened upon it with a Google search. Hence the reason for my late attendance. Transparency all the way around needs to be enforced. How much money do the PASAs make from the percentage that they take from the host home provider? What are the required trainings? Have the agencies been held accountable for unethical behavior prior? Host home providers and their clients have a right to privacy. Just because a host home provider doesn't want to allow the day program staff into their home does not mean that they have something to hide. Imagine that you answer the door for the mailman and he wants to look past you or around you and gets a little too close. This happens frequently. Or if you leave the door open for your client and they just simply walk in without being indicted.
Hey, Sarah, I'm really sorry to cut you off, but I do think we're going to have to get to other folks that have feedback. So if you want to
Wrap it up
and come to a conclusion, please.
Yes, absolutely. Okay, just a couple more things. A public list of host home provider blacklist is retaliatory and could be considered slanderous. So I definitely urge you to not do a public list. I know that was in discussion. A private one, that does make sense. I completely agree with all of the background checks and making sure that the clients are safe. But I also think that there should be a threshold that needs to be met before a person gets on a list. Thank you.
Thanks, Sarah. And we're really glad to have you here in this meeting and to have the perspective of a host home provider. We fully agree with you that there should be a process for grievances. We would urge you to reach out to us if you have issues like that, and we can point you in the right direction of filing a complaint to the public health department. So really appreciate all of those comments. I do want to just hit on a couple of things that I've seen throughout the chat, and I want to make sure we open it up to lots of open it up for other folks to talk. We absolutely are in agreement that, and what we don't want to do is create a public shaming blacklist. We are really trying to thread the needle between ensuring that subcontractors, that is what most 99% of all host homes are not hopping from one PASA to another and continuing to operate and provide bad, unsafe, ineffective services. And because they're not enrolled with Medicaid, we cannot terminate them like we can a provider agency. So how can we keep those bad actors, prohibited providers from continuing to provide those services? That has really become the struggle that we have been dealing with for quite some time. Obviously, we would work with stakeholders if this is the direction we're going on what a threshold looks like, what kind of grievances and incidents need to occur for it to rise to such a level. HCPF does have a pretty standard process for what that looks like when a provider agency is terminated. And so we would continue to follow something similar to that if we were to enroll host home providers and follow that route. I just wanted to share some information there. You know, again, all of the things that we are putting together today and through this process is not something that we are going to put into and implement tomorrow. What these are recommendations for the legislature to consider in terms of how can they support and what do they want to do in terms of increased oversight or additional resources for HCPF in the host home realm. So these are ideas that we have. Again, I'm loving seeing some of these comments come in about the background checks. All of that will be included in that survey. So if you are in disagreement with doing it one way, please note that in the survey. Are there other folks who would like to speak up, share their thoughts? I see, Dee, you have your hand raised. Please go ahead.
Yeah, we have, we're hearing things about like, oh, we want to like tag or identify, keep a database of people who shouldn't be providing services. But what we haven't really talked about, or at least not here, is that we have an awful lot of family caregivers who are acting as host homes. And we have a lot of, at least we do, we have a lot of people in service that they want to be where they are. And what I've heard so far is a lot about, prohibiting somebody from service, or serving others, but not a lot about like how we would do remediation. Like, how do we fix the situation? Because there's probably a very small amount of people who are, who are doing things, out of ill will. They're actually, things might be overwhelming, things might be difficult, things like that. We haven't really talked about mechanisms for remediation to actually support the choices of the people that we're serving. So has there been any discussion around that?
Yeah, thanks, Dee. That's a great point. And it has been. I think you're absolutely right that most folks who are providing services and who perhaps are not properly trained or are providing quote unquote bad services are not because of malintent. So absolutely, when we've talked about kind of that prohibited provider list or some threshold of them that individual no longer being able to provide services, it would be after, multiple attempts at remediation in terms of, hey, this is not allowed. You can't do things this way. talking with the provider agency about the lack of training. The problem is that information is typically relayed to the provider agency. And if that information does not go from the provider agency to the host home provider, then that host home provider isn't always in the know, and that they're doing something incorrectly or need to be retrained. So I think that's all part of, I like to call it the blessing and the curse of the host home provider PASA relationship, in terms of, provider agencies are able to subcontract and open up to a much broader provider pool, but that means that HCPF does not have that relationship and does not work directly with that host home provider. And so how do we, and I'm open to suggestions of how can we make sure that that information is being provided and that feedback is being provided to the host home provider.
Or you mean specifically about training, or that things need to improve, or
I guess
I think
feedback of how we can get that information directly to a host home provider. I think that's often the challenge of, let's say a CDPHE survey goes out and says, hey, provider agency, this is some concerns that we've noticed with your agency. Folks are not being trained, X, Y, and Z. How does that information go from the agency directly to the host home provider? And I see, B, if you have thoughts, I see, Sarah, you've got your hand raised again.
Yeah, sorry, I'll be quick. I actually have some pretty good ideas about that. Creating a shared website that host home providers can upload their trainings directly, because I think that it should be their responsibility and not the agency. And that kind of takes some of that pressure off of the agency. 1, 2, the agency can monitor it, but HCPF can also have access to that training portal to upload. And so everybody can have access to make sure that everything is being checked off, and an automated message could be sent to the host home provider saying, hey, you're responsible for completing X, Y, and Z. I think that would be a really good way to take some of the pressure off of the agency and also the state. So.
Thanks, Sarah. Maureen, you've got your hand raised.
Yeah, I have a couple points. First of all, I really want to, again, voice my concern about this process. I don't think going into individual work groups, which may have been mentioned in OCL newsletter that not every stakeholder reads, not having it posted with the time, the date, and the link on the main host home provider workgroup oversight page basically puts those meetings into the darkness of the open meetings requirements. So I want to make that clear, and I will be sharing that during the SMART hearing, that I think you cut out a lot of voice, and opening a survey for 1 week is not sufficient. I don't even know what the survey has as far as accommodations for someone with an intellectual disability, how you're going to be able to capture them in 5 working days. You need to leave that thing open for a month, and you need to do a marketing job, because you all messed up by doing secret meetings. Number 2, I'm really concerned about this idea that you can carve out family caregivers. As a future family caregiver myself, I don't see how you can have 2 classes of people within one subcontractor group. I think if you create a blacklist, it will impact families like mine, and we will be silenced. We will fear for being outspoken because we could get put on a blacklist. It could be weaponized as a retaliation use. So that's a big concern to me. And I want to voice my support of the good host home providers. I'm not sure, since I wasn't able to participate in your secret meetings, if you're going to address prevention. Right now we're talking about punishment, and as a parent, as a recovering special ed teacher, you can't just have punishment, you also have to support. You have to create prevention measures and figure out how we can prevent host home providers from becoming overwhelmed, from becoming stressed out, and not getting the support and the respite they need. And it is a 24/7 job, 365 days a year, Julie, and there is no respite for host home providers. It just doesn't exist. So yeah, we have a lot of issues here, and I'm really sad that HCPF did not hold open meetings for these, and I encourage everyone to attend the SMART hearing in January and question the entire process. Of course, we probably won't see the report until you all have it in SMART committee, so that'll be another way that people with disabilities can't participate because they won't be able to see the report in advance. So that's it. Thank you.
Anyone else have any questions or comments that they would like to make? We've got a couple of contacts on the website. Again, you know, this is the culmination of hearing from stakeholders throughout the last several months in terms of what are our desired goals in terms of oversight and creating a better program for individuals on the DD waiver and residing in host homes. So this has been from all of those conversations. Go ahead, Julie.
Thank you. I agree that 1 week for a survey is really a problem, particularly for the population of people that might need support filling it out. And for people where like they're relying on other people to get the survey. So like in the advocacy world, you know, it might go on a list and then people on the list, you know, send it to their peers. So that does concern me. And I also hope in the survey you identify the role someone has, because the providers have a well-funded lobby and people with disabilities don't. So, you know, these meetings have been very outsized with providers and their opinion is important and we need to hear it. But if it's just numbers of how many people support X versus Y, it's not going to adequate. If it's not weighted and you don't know kind of like who's filling it out, it's not going to adequately represent the perspective of those with disabilities, particularly those who might live in host homes or their families. So I think I just wanted to say that. I don't know what the exact right amount of time is, but I do think a week is really inadequate for people who don't, especially for people who don't like get paid to do this kind of stuff all the time. And I know that this is about host home, you know, improving the situation with host homes. But I do think that this respite thing is at the heart of a lot of the problem. And we hear all the time that there's no respite. And so like that issue has to get solved, because no one should be doing 365 days a year of anything ever. Like that's, and if we're saying that's the norm and that's just the way it is, I don't find that acceptable. Again, I know that isn't necessarily this group, but I think maybe one of the recommendations could be, as a state, we have to address respite, because I don't care if it's having been a family caregiver, but like whether you're caring for a person as a family member or as a paid provider, like that's just unreasonable. And it's gonna, whether it leads to abuse or someone being so fatigued that they drop someone or they miss meds, or like no one can do that and not make serious mistakes, like in any job.
All right, thanks, Julie. Appreciate those comments, and we can definitely keep the survey open for longer, and we can ask that folks self-identify with what groups that they associate with, for sure. I do want to be clear that we had representation from not only provider agencies, but from the advocacy community as well participate in this, so making sure it was not heavy one way or the other. Any other questions, comments folks would like to make? Yeah, Maureen.
Yeah, I'm just wondering, who was it that picked the members of those groups, and how was that done, the process for that, for the breakout groups that were not held publicly?
Sure. They were nominated by representatives of the provider community and the advocacy community. So they were nominated by their peers, I guess you could say.
Group that was represented that had individual host providers considered for that group?
Yeah, we tried to get representatives from all areas and we were not able to get those.
Yeah, see, that's why they should have been held open. That's
So
why
I think,
opposed
as
this
Sarah
process.
mentioned, we don't get representation from individual stake members or host home providers in these meetings. So those members of the work groups were listed on the website, and in that.
Actually, I didn't find them on the website, Cassandra. I had to email Victoria to get the names of the members. They were not posted on the website,
Gotcha.
unless you put them up at the last minute, but I never saw them on there.
Thanks, Maureen. I will make sure that we have some kind of, because I think Julie's point is a great point about a recommendation about respite. We will certainly make sure we'll do some last minute tweaks to that survey, that we can leave space that if you have an additional recommendation, if Maureen, you want to put in there about prevention, Julie, if you want to mention about the need for respite, that someone can't do a job 365 days, that's an excellent place to put that. And then we can look at culminating those additional recommendations for the report. We'll give you the link. We're going to work on making just a couple of small tweaks at those things for my team. If you're not already, if those things are not already in there about self-identifying, and if there's not a place to do additional recommendations, we'll get those in there. We will keep the survey open until, how about we say, maybe the 15th of October. That's 20 some days. We can, that way we have enough time to do information with the, collect all of the feedback out of those surveys and then work with that information. So we'll keep it open until the 15th of October, and put the link to that into the chat. Are there any other, I certainly don't want to hold people hostage here in a meeting if there's no feedback. Is there anything else folks have aside from longer on the survey? Or anybody who'd like to comment on comments from other stakeholders today, kind of engage in a conversation here. Okay.
So one thing, when
Yes.
I first, sorry, when I first became a host home provider 9 years ago, they used to give, God, I can't remember the exact number, but they gave a certain amount of numbers every month, or a certain amount every 3 months of respite days, that were paid respite days for the host home provider, but they took that away. Gosh, I want to say like in 2017, they took that away. So it was in play at one point in time. So.
All right. Thanks, Sarah. Just a couple of other quick things that we will continue to engage with stakeholders. We absolutely will work with provider agencies on the database as we continue to move forward with that. Again, as Jody mentioned, all of these things kind of work together. The database will help us better track training, placement of individuals, host home providers who are rendering services and who they're associated with. We are moving forward with, the department has developed a new training and an LMS training that should help inform providers on all things HCPF, but some specific things of what is required when you're providing residential services. So that should be launching, because totally agree that the more informed, the more trained, the and all of those things for the providers and host home providers, the better services will be overall. So really pushing that information and training out, so that things are not just punitive, and trying to coordinate efforts with our partners over at the health department to ensure that any regulatory changes or changes that we're doing here are reflected over with their agency, as well as making sure that they are surveying with components of training and technical assistance, and not just punitive as well, to your point, Maureen. So just wanted to put those plugs out there. You will be continuing to hear from us. We will make sure that the link and information about the survey is also in the next edition of the OCL email blast. And we'll make sure to get that spread far and wide, keep that open for a while. Any other parting thoughts? Yes, Maureen.
I was just going to say, if you do want the parent voice, I think you should be asking the case management agencies to get this information to consumers. They have all the direct contact with their mailing list, and I'd really like to see that survey go out to everybody on the DD waiver. And also families like me. I have a child on the CES waiver, and I will be transitioning to the DD waiver. So I recommend that you put that on the case management agencies to send out the link to every single enrolled member. Thank you.
Sure. We can certainly make that ask, as all of you are probably aware, case management agencies and the workload is pretty high. We hate to put any additional strain, but we can certainly make that request that they have this link and survey available to folks. Anything else?
Cassie, I was going to say,
Oh, yes, please.
I've already sort of put out the ask if there are agencies that are interested in helping in the database. That also goes for host home providers. You know, the idea of being able to upload documentation of your training, that's something we could certainly incorporate. And it could be then available to whatever process you're working with. So we'd be very happy to have people help on that side as well.
Great, thanks, Peggy. Well, if there are no final comments, I will thank you for your time today, for participating. If you did not share your feedback here, we please, as we have said multiple times, we urge you to share your feedback and your thoughts on those thoughts on those recommendations in the survey. So that's your opportunity to make sure your voice is heard. And we will get that distributed far and wide. But otherwise, thank you all. Hopefully you have a lovely Thursday afternoon.